My name is Jim Mustick. I'm Senior Advisor to President Carey, and we've decided to do tonight's speaker series as a conversation between Todd and myself. Todd is indeed transformative. I've spoken to him for 12 minutes since he arrived on campus, and all of my questions have been revised based on that conversation. Todd, you founded Devoted Health in 2017. We'll go back to your earlier career because there's some fascinating things to talk about there. And the idea of treating people like family and combining that with powerful technology is kind of counterintuitive to some people. You launched this before the burgeoning of generative AI since, and as you explained to us as we were speaking where we grabbed a bite, you've been riding that wave too. Could you talk a little bit about, one, how the human connection remains paramount, how you use technology to do it, what that concept is, and then the role that, how you've been building an AI platform on top of this kind of, as AI evolved. It's very interesting. So let's start there.
Sure. Well, first, it's fantastic to be here. Thank you, everyone, for making time out of your busy schedule to hang out for a bit, and hopefully this will be a semi-useful use of your time. So the mission of Devoted is, as Jim was saying, is to dramatically improve the health and well-being of our fellow Americans, starting with elders, by caring for every single human being like they're literally our own family. And for us, these are not words on a wall. They're not banners that no one pays attention to. They are the fundamental metaphysical DNA of our culture. If you ask any of us at Devoted, all 2,300 of my sisters and brothers, and say, why are you here? They will all, no matter what their job is, whether they be an engineer, data scientist, clinician, operator, they'll all say, I am here to care for every human being like they are my, and they'll name someone that they love desperately. My mother, my father, my sister, my brother, my daughter, my son. Every single human at Devoted will say that. And if you think about, like, what would you want for healthcare for your own mom, for your dad, for your daughter, your son? You would want the very best healthcare on the planet, yeah? I would hope so. And it turns out there's a very precise algorithm that defines what the best healthcare in the world is. It's the right care, whole person care, prevention-oriented care, clinical and non-clinical care, loving, empathetic care, the right care, delivered in the right place at the right time, in a highly consistent, coordinated, and proactive way. That's what the best healthcare in the world is. For everyone here who's familiar with the status quo American healthcare system, you will be correct in saying that that's not how the current system rolls. Right? It has the best clinicians in human history staffing it. My wife is a doctor. She is better than me in every conceivable way. Right? And even she and her compatriot doctors, and all the doctors will say, as awesome as they are, the nurses are even better. Even they, right, struggle to truly heal people in a system that is really more like an anti-system. It seems to be actively thwarting people's will to express the healing power in their heart. It's a system that's massively incentive misaligned, fragmented, uncoordinated, disorganized, information poor, high friction, non-prevention oriented, non-whole person oriented. It seems to treat people like bags of organs to be severed from each other and dealt with individually. Right? And a system that's terrible at getting people the right care up front, the right whole person care up front. And because it can't get people the right whole person care up front, what happens? Way too many things happen to people, terrible things that should have been prevented. Trauma, suffering, death. Hospitalizations that should have been prevented, surgeries, all kinds of interventions that happen when things happen to people that are terrible, many of which should have been prevented. As a result, America manages the double feat of spending more than double what the rest of the developed world spends on healthcare per capita, with outcomes that rank at the very, very, very bottom with respect to preventable illness and death. The good news is that over the last several decades, brave, iconoclastic American innovators in certain parts of the country said, this is insane! And in local ways that were not scalable, but nonetheless highly instructive, came up with local ways to get people the right prevention-oriented, whole person-oriented care up front in a coordinated way. And they discovered that when they did that, two things happened. Outcomes do this, and costs do this at the same time. Why? Because, as grandma would say, a stitch in time saves 9. If you take the right whole person-oriented, prevention-oriented care people up front, you keep them healthy and well, and out of the extremely expensive hospital. So this is a model that my brother and I have been studying, my co-founder Ed, our whole lives. And what we did at the dawn of Devoted to instantiate the mission of caring for everyone like family, and therefore wanting to get everyone the best care in the world, is we said, let's take this model that a stitch in time saves 9, and combine it with what technology can do in the early 21st century to build the first solution that can hyperscale this care to everyone everywhere and turbocharge it. That turns out to be very complicated to do, but it is doable. And the way that we actually figured out how to do it is we essentially built an alternate universe American healthcare system as a service, powered by technology and a culture of love. And we called it an all-in-one healthcare solution for American seniors to start. And we think of it as a virtual blue zone. Well, are you all familiar with the blue zones? These are like 5 areas around the world, like Okinawa, Japan, and Ikaria, Greece, and Sardinia, right? Where people live much longer, healthier, happier lives. We think of Devoted as a virtual blue zone, accessible to anyone everywhere. And you join it, and you lead a much longer, healthier, happier life, because you get the care that we want for our own family. The way that we actually deliver that, if you kind of peer inside this Devoted solution and say, well, what's in there, right? It consists of 5 ingredients that we built deeply masochistically, but necessarily from scratch, all at the same time. We built our own health insurance plan to provide the funding for our care model. We built our own in-house tech-enabled professional daughter and son service, we call it Guide, that are your personal concierge navigators to navigate you through the liquid ball of roiling chaos. That's American healthcare. We built our own in-house medical group, an amazing group of clinicians called Devoted Medical Group. That's the first truly great virtual first, i.e. telemedical first, whole person oriented, prevention oriented, comprehensive, primary and specialty care provider, delivering 98% of its care telemedically. And we complement that with a network of brick and mortar clinics and hospitals who are great partners to us if you need brick and mortar care. And then we built an underlying tech and now AI platform called Orinoco, which is the first ultra-modern tech platform that can run the entirety of an insurer, a navigator, and a care provider. Which more fundamentally is a right care, right place, right time machine. So from thousands of different sources, it's gathering a complete picture of you, both clinical and non-clinical, and then analyzing you constantly to say, what is the care that you, Dr. Carey, need next, and next, and next. And the software is doing the very complicated choreography behind the scenes to order our health insurance plan and our concierge guides and our medical group, working with other providers, to all come together in the exact right pattern. So what you experience is very simple. You just get the next right thing, and the next thing, and the next thing, including a whole bunch of stuff that you never asked for, but we practically give you because we know that's a stitch in time that will save 9. And the most important ingredient, I will testify to you right now, in this stack is actually not the technology. It's actually an ingredient that I haven't named in this description yet. It is the culture of the company. It's the culture of the company. I'm old enough now to know that culture eats everything else for breakfast, lunch, and dinner, and midnight snacks. It trumps strategery, ops, technology, right? culture defines everything an organization does. It defines its why. And our culture, we very carefully tended to it from birth. It's our #1 priority. And the culture very simply is defined by the principle felt by everyone in their core that every human being is family. That's the soul that built the body, that built the health insurer and the guide navigators and the medical group and the technology platform. It's the soul that improves that body, constantly animates that body. It's the most important thing about Devoted. And the combination of everything I just said, just empirically, because we're people with big hearts and we're also super geeks, so we measure everything, right? This is a colossal pain in the butt to build. Incredibly difficult, right? We raised $2.3 billion to fund building it. My brother and I assembled like a team of ridiculously amazing people, right? Like the Avengers, like from all corners of the earth to like build this thing. And we worked incredibly hard for a very long time. And the payoff is that this thing is now out in the world and doing things that we can't even believe. It's delivering levels of member happiness higher than Apple and radically higher than healthcare in general. It's delivering population health outcomes that are, as far as we can tell, double the previous world record on any dimension. And it is lowering the total cost of care relative to the Medicare average by 42% for an equivalent population. And we're spending more on primary care, by 28% more, but that's a stitch in time that's dropping hospital spending, specialist spending, ancillary spending like a rock. Why? Because we vaporize the need for that stuff to begin with. Because you are healthy and well. And so we've just really begun to begin, in a sense. We care for 200,000 beautiful souls across 20 states, but that's about to triple. Triple, actually, this coming year, based on what's happening in our current open enrollment. And we're beginning to actually think about how to bring the power of this outside seniors to people in other population segments in America. And we're talking to multiple countries to bring Devoted to their country because they're asking us to. And so we're at the beginning of the journey. But what I can tell you is that amid so much that's happening in healthcare that is highly challenging, I've never been more optimistic about the ability to actually make it dramatically better. And I think that, you know, if there's one message that you take away from this evening, right? Everyone's talking about AI. Yeah, it's awesome. It's transmogrifyingly powerful. And it's only going to transform healthcare if you intertwine it with love. That's the only way. And Devoted's a living example of the power of that intertwining.
Let's go back to your beginning in your career with your brother in Athena Health, where you started out with a similar idea of preventive medicine and whole person care around pregnancy, but you soon found out that the care was not the only problem.
Right.
Could you talk about that a little bit and we'll build back up to where you ended up?
Yeah, so this was a catastrophic failure. Catastrophic failure, and the single most valuable learning experience I've ever had in healthcare, right? So to set the stage, like I was 24, my brother was 22, my best friend John Bush was 27. We knew nothing about anything, okay? And sometimes that's a feature, not a bug, because you're just having on the memo about what you shouldn't try to do. Right? So he said, let's start a company. Sounds great, right? And let's start a company to help moms and help improve maternity care for the vulnerable, because who doesn't love moms? Everyone loves moms, right? What could be more awesome than helping moms? So like 3 young dudes without a clue decide to start a company to help moms, right? And we do a bunch of reading and we discover this model, a wonderful model of maternity care called the collaborative care model of maternity care. And actually this audience may be familiar with this model, but it's this amazing model where, as opposed to like a doctor seeing you from time to time for like 25 seconds and hoping for the best and then intervening if something goes terribly wrong, it's a team-based model of maternity care where you have a doc and a certified nurse midwife and a educator, and a social worker, and a nutritionist, and a care coordinator that all team up to love on a mom-to-be and deliver much more care up front that's all enveloping in the prenatal and L&D period. There's a federally funded study on this model that we found that showed that this model of care, whole person-oriented prevention-oriented care up front, cost more up front, but actually cut the total cost of a pregnancy episode by 20%. Why? Because it actually radically reduced the rate of terrible things happening to mamas and babies. Radically reduced the rate of premature birth and NICU stays and maternal complications, et cetera. And we were very excited by this, and we naively thought, this model both improves outcomes and cuts cost. We should be able to scale this across America. No problem. Yeah? So we then proceeded to buy the practice that was the subject of this federal study. The hospital system that we bought it out of seemed suspiciously eager to sell it to a couple of yahoos, right? Who've done nothing before in their lives. We thought we were like the greatest deal makers ever. It turns out we were the guys willing to hold the bag on a practice that was basically losing a lot of money, right? Because it was investing more up front and it wasn't being paid as a medical practice for all the care it was delivering up front, right? So we said, no problem. We're going to go to all the insurers and just ask them to change how they pay for healthcare. That's it, right? We don't want to be paid like fee for service for the doctor or midwife work. We just want you to insure, just go compute what it costs you to deliver pregnancy care, all in for pregnancy. You know, the doctor care, the professional care, the hospital care, the NICU care, the ancillary care, medication care, and calculate a global case rate for total all-in cost for pregnancy, and then cut it by 10%. Pocket 10% savings out of the gate, and just pay us in this new format, called a global case rate. And then because we're paid that rate, and we cut the cost by 20%, we can make the whole model work. We said, who would say no to this deal? Turns out, everybody said no to this deal. Every single insurer said, kid, which is fair, I was a child, right? We believe this model works, we believe the federally funded study, but we cannot, and we will not, change how we pay for healthcare for you. And it turns out there's a whole bunch of strategic, operational, and technical reasons for why that was true. But whatever the reason, it was true. And so we did not get paid a global case rate, so we were going to be the captains on the ship when the best OB practice in America, the one that served undocumented immigrants and Medi-Cal beneficiaries and others who were in enormous need of the best care, we were going to be the captains of the ship when it sank into the sea. And we said, we're just not going to be the captains that were responsible for that. So we threw everything in the kitchen sink at saving this practice, and we did, including building the first internet-based software to run doctors' offices, integrated with a medical billing service that radically improved cash flow to doctors, which was part of how we saved the practice. And then Athena Health became that, right? Venture capitalists were, this was the late 90s, they were super excited to fund a communist software and billing company for doctors. And Athena Health became very successful. It added electronic health records and patient communications. It runs a big swath of the US healthcare system. It got bought recently for $17 billion, right? By a lot of measures, it's successful. But I don't actually consider it to be successful. I mean, I'm very proud of it, but I can't point to a single baby whose care was made better by our communist software. Because all software can do at the end of the day is just make the current system more efficient at what it already does. It cannot change the fundamental nature of that system itself. And so I had a hole in my heart that I carried with me from Athena until my brother and I took our second shot at being genuinely helpful to the US healthcare system and started Devoted. And you may have been wondering when I relayed what I described as what Devoted's built. You may have wondered, why on God's green earth did they build a flipping health insurance plan from scratch? now you know. So this time, we're going to take our prevention-oriented, whole health-oriented model. We're not going to go to the legacy insurers and ask them to pay us in a new way. We're just going to build our own flipping insurer and just acquire members ourselves. And so, the lessons of Athena we carried with us. Our obsession with prevention and whole health, we've had it since we were babies, basically. Yeah.
In between Athena and Devoted, you had a little stint in public service. And speaking of the Avengers, you were kind of called in to rescue healthcare.gov after it floundered at the beginning. Could you talk a little bit about that and what lessons you learned about the system and policy, and how did that inform on top of what you learned from Athena before you got to Devoted?
Sure. Yeah. So so in between Athena and Devoted, I got recruited by the United States government for what they promised would be. They promised my wife it would be 1 year. It became 7 years because that's how America rolls. Keeps asking you to do more and more and more, and you have to say yes. It's not exactly the first thing an entrepreneur plans on doing. And it was absolutely the most extraordinary experience. So one other takeaway that I would hope you take away from this, actually, is if your country asks you to serve in any capacity, just say yes, and you will not regret it. You'll not regret it. So my experience was I was recruited for policy jobs. So the HHS CTO, US CTO, and basically policy advisor jobs, where my job was to think and write elegantly worded memos about net neutrality and open data, right? But what really became my experience was, because I was a geek, and I happened to be there, when the fit hit the shan, or amazing opportunities materialized, need to be acted upon quickly, people would say, hey, Todd, yeah, you. Would you mind just drop the policy memo pen for just a sec here, okay? Would you mind going to work on that? So like fixing healthcare.gov, which is an incredibly stressful experience and an extraordinary one. Or the director of counterterrorism on the National Security Council called one day and said, we are losing, Todd, a propaganda war to ISIS on American social media platforms, which is deeply problematical at every conceivable level. Can you help figure that out? And so I said, yes, ma'am, I will go work on that, right? Et cetera. Missions that are stressful beyond imagination, but because they're so deeply meaningful. And it turns out that actually the US government's so big that it actually isn't really a commanded and controlled organization from the top. It's so big, it's really a sector. And the right attack pattern to change it turns out to be remarkably similar to starting a company. So I'd be given a mission, like go fix healthcare.gov or go figure out how to beat ISIL in an information war, and I would assemble the best team in the universe to go after that. Some of those folks were in the US government, others were not. And I discovered that one superpower working for the White House is that you can call anyone and say, hi, my name is Todd, I'm from the White House. The president would like you to help with a mission of crucial importance to the country, and people will drop everything and go. It's amazing, right? And so I would assemble a team, and we would go attack, and we would seek to learn at maximum speed which of our assumptions were right, which ones were wrong, especially the ones that were wrong, and actually put forth an initial solution, and then based on how that did, iterate at incredible speed, continue to learn, and iterate with the solution at incredible speed until we broke through. And that is a pattern that entrepreneurs in the audience will recognize as very similar to building a company. In fact, I was interviewed once by Federal News Radio, and they said, we want to talk to you about what it was like to be an entrepreneur and now become a bureaucrat. I said, well, it's actually pretty similar based on what I've been asked to do. And I described basically this pattern. And they said, well, so changing government is that easy then? Like starting a company. I said, just to be clear, starting a company is one of the hardest things you can do, as is changing government. Both are incredibly hard to go from 0 to 1. But if you actually build the best teams, and you maximize speed of learning, and you attack in the right way, leveraging both, then it is quite possible to win and deliver on the mission. I think one big takeaway for me, actually, I was reflecting on this at the end of my 7-year tour of duty, is if you approach public service the right way, and Dick Gephardt is the living embodiment of this, right? Public service redefines for you what meaningful work even is. It resets your bar about what meaningful work even is, because in public service you can do the most meaningful work imaginable, as Dick exemplified with his entire career. And to me that's a feature, not a bug, right? And you hear this from folks who come home from their tour of duty serving in the military, etc., right? That they really grapple with, what do I do now? Because I know what meaningful work really is. And so Devoted was the only mission I could come up with that cleared that bar. And the only thing my wife let me continue to work on, she just wanted me to retire. But I pitched her on Devoted, and as a doctor she said, okay, you gotta do that. I said, well, it'll be the rest of our lives. She said, I know, but you gotta do that. You know? It's another form of public service for me.
So Devoted seems to be, as many things seem in retrospect, a kind of culmination of all of these learnings at great scale. You said now 200,000 patients. What was the idea at the beginning as far as the technology was concerned? Because the technology has, you knew the need for your own staff and your own insurance, health insurance solution, and all those things. The technology has changed exponentially since you launched. How were you prepared to take advantage of that?
Yeah. So who here is a geek, like a tech geek? Anyone? Don't be shy. Okay, great. If you ever become a geek or work with geeks, one of the most important principles is surf. Build a surfboard, right? So technology changes so rapidly, and in the AI age it's changing even more rapidly, that if you build for what tech can do now, you are going to be out of date increasingly quickly. So you want to build a tech platform that's a surfboard, yeah? And I cannot literally surf to save my life, but I'm a pretty good tech surfer, right? So what does that mean? Without boring you to tears with massive geekery, the thing you want to do is you want to build a tech platform that is essentially Lego blocks, right? You don't want to build like a monolithic slab of stone, right? That is exquisitely crafted to do a particular thing and is very difficult to change. You actually want to build a tech platform that's essentially a Lego kit that can be snapped together in all kinds of different patterns. And that way, when a new set of incredibly luminescent, superpowered Lego blocks appear, called AI, then you can just add them to your Lego kit and make much more awesome Lego stuff. So that's really it. There's a bunch of deeper stuff we could discuss there, but essentially, Devoted built a platform that is fundamentally a Lego kit with a composable services architecture that's externalized as data schema on the wire, all of which is a way of saying it's a bunch of Legos, right? And they were able to infuse into it AI such that it became an AI native platform that was built before Gen AI became a thing, because Gen AI got added as additional Legos into Lego kit. So now the whole thing, right, is natively able to leverage the AI Legos. If that makes sense? And as ever more powerful bricks materialize, then they can be leveraged to do ever more powerful things. So to kind of mix metaphors, it's a Lego surfboard. I don't know. But this is actually quite important as a principle. So.
Talk about how specifically AI has enabled you to devoted to tackle care. We think of care as human to human directly, but as you mentioned before we got on stage, there is an enormous cognitive investment in care, which you are finding ways for the AI to lower the cost of. Could you talk about that?
Totally. So what we're finding is that AI can take the cost of what we do down dramatically and impact its efficacy and personalization dramatically. There are a number of key ways this manifests. So one way to think about is that inside our tech and AI platform, we have 4,100 agents that are running around. That are doing work and taking on more and more and more. One of their key mission sets is that basically they're doing a ton of work that humans hate doing. And if you actually look at the life of a concierge navigator or a nurse or a doctor, right? And you just look at their day and what they do. There's like a whole bunch of stuff that they do that they really dislike doing, and that AI can do much better. So reading hundreds of pages of documents for a given patient and summarizing all of it in a way that is really cogent and prepares you, right? Documenting what happened in an encounter, like filing all kinds of codes and other like planning documents and so on and so forth, that really an AI can just take the first shot at, and for a human to then modify and improve. But then secondly, the AI agents are force multiplying the power of what the humans do. So as an example of this, we have an AI co-pilot for clinicians who manage people's transition from the hospital to the home to make sure that when you go home, you recover, you don't get sick again and come back. And the medical director of the service is a hospitalist from the Mass General. So he's one of the best hospitals on the planet. And he was sharing to us his experience with one of our new co-pilots. He said, Todd, I was seeing a patient, and the AI agent's job is, in this case, to surface the top 3 reasons why this person might go back in the hospital. And the AI agent, and there were literally like 600 pages of PDFs that we'd gathered from all kinds of other providers into our system, and it found on like page 348 or something, an incredibly obscure detail mentioned exactly once, years ago, of this person's medical history. And they then connected it, the AI agent did, to an incredibly obscure branch of medical knowledge, a branch of a branch of a branch of a branch, and correctly surmised that the combination of this and that, this obscure detail of this person's history and this obscure detail of medical knowledge, was one of the top 3 things that could land this person back in the hospital. And this doc said, like, you have to say, he's one of the best doctors in the world. And he said, in a million years, I never would have caught this, ever. Because I don't have the time to read 600 pages of stuff. And that detailed medical knowledge is so obscure, no one thinks about that. He said, it's irresponsible for a clinician to practice without this AI co-pilot. I want my mom, he literally said, to be cared for by a clinician who has this AI co-pilot. And so, a kind of underlying moral of the story, right, is that we're not using AIs to replace humans. We're using AIs to turn every human devoted into a superhero. Right? If you've seen the movie Iron Man, right? We're equipping everyone with Jarvis, right? And a whole fleet of agents, right? That force multiply what you're able to do. And able to really do what you uniquely can do as a human, which is to build a heart-to-heart, empathetic connection with another human and exercise your superior human clinical judgment.
Let's talk about what that human in the loop needs to know and how they learn it. And I want to go back to your Athena Health's experience in healthcare.gov. I've read when you were realizing that the real problem with Athena Health, or one of the real issues that you hadn't got your head around because you're thinking about care, was billing. And you went to find hospital billing experts who were unsung heroes who had sticky notes on their computer with all the rules for the different companies. And in healthcare.gov, you came up with a principle called L6, which was you had to go 6 levels down in an organization to find somebody who actually could address the problem. So that's telling in itself. It was not the people at the top, the people who were in power or in authority. It was somebody further down the chain, and you became adept at finding these people. My question is, to get back to Devoted, is as AI takes over more and more entry-level positions and work, and the work that people don't like to do, how do those people have the opportunity to develop the feel for their domains that allows them to have that knowledge?
Yeah, it's a great question, and I think it's a really important, ongoing, not yet, I think, crisply answered question by society, right? Where AI is able to do more and more of the cognitive work that entry-level positions do, right? But you don't get to be a master of a discipline unless you get to start at the entry level. So I think for us, right, I mean, we're not eliminating entry-level jobs at Devoted. What we're just doing is expecting more, right? So what we've actually found is that like an entry-level guide, Guardian Angel, when equipped with basically the AI-powered suit of armor that we put them in, are able to function instantly at like a much, much, much higher level from the get-go, right? And then progress from there. So I think that's the key. I think organizations that don't do that, that just simply replace all the entry-level jobs with AI, and I think that's likely going to be extremely short-sighted, you know. And we believe at Devoted, right, that we're always going to have a human in the loop for what we do, and believe that's going to be essential. At the end of the day, right, the most essential element there is that, and I can testify to this personally, that core to our healing power is that the member at the other end of the phone or the video screen or the chat, they know there's a group of humans over at this end that love them maniacally. Humans who love them like family. And I think as every clinician in this room knows, love in and of itself is healing magic, right? If someone feels cared for and heard and seen, they are going to have a better health status than if they don't. On top of actually that enabling trust, which then enables you to help them, but just being loved in and of itself is incredibly powerful as a healing force. We have seen this, we have the data to demonstrate this, and that is at the core why we always believe, no matter how powerful AI becomes, that we'll have a human in the loop.
I'm going to ask one more question. If we have somebody with mics going around, we're going to invite questions from the audience. So if you put your hands up, we'll get to your questions as well. But Todd, my last question to you is, AI is enormously powerful. It solves problems by redefining them with information, as in your example, that might not have been available or comprehensible to humans. At the same time, there is a class of problems, and this is what's interesting to me about the DNA of Devoted, that are not well defined and will never be well defined. There are aspects of care and illness and mortality that the machines can't help us with. Because they're not, life is not a well-defined problem. There are aspects of it that can be. Same thing is true of health. How do you think about that in terms of what you're trying to build at Devoted?
Yeah, it's such a great question. I mean, just to reinforce this underlying theme, to really heal someone, you have to heal the whole person. You cannot define them as a bag of organs with clinical issues. Right? That's not how this works. We find that actually to heal the whole person, you have to address both clinical and non-clinical elements in an integrated way. And maybe one point to bring this home is one of the standard protocols of our medical group, right? Our standard care protocols is we reconcile you with your estranged family. I don't think there's a Medicare CPT code for that, but there should be, because I can tell you the power of that, right? So we routinely do this. And first, as I think every clinician here knows, right? If you do that, then you give someone a caregiver. And a caregiver is a life changer. The second thing, to return to an earlier point, is that I'm thinking about an actual member now, right? You know, if a member who hasn't spoken to his son in 2 years because he lost his wife and he lost his business and he fell into opioid addiction, if that member who hasn't spoken to his son in 2 years has not met his grandson, is reconciled by us with his son and meets his grandson for the first time, that is a healing act of incredible power. Broken hearts lead to broken bodies. Whole hearts lead to whole bodies. And this is a very important part of how we think about care.
Todd Park, thank you.
My pleasure.